Chronic conditions are rarely just structural. They are regulatory. And microcurrent works beautifully at the level of regulation. Hello and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today we're talking about something that so many people are navigating quietly: chronic conditions. We're going to talk about when symptoms linger, when progress feels inconsistent, when treatments help a little but not enough, and when the pattern feels complex or layered. We're going to talk about how easy it is to start feeling discouraged. But I think the truth is that chronic does not mean hopeless. In this episode, I want to share a practical framework for working with lingering or complex patterns, particularly through microcurrent. And this will include what to work on first, how to pace your treatments, and how to build steadier, more sustainable progress over time. Because ultimately, healing chronic conditions is less about intensity and more about strategy. So first off, let's talk about what a chronic pattern is. Acute problems are often very straightforward. You injure a tissue, it becomes inflamed, it heals. Chronic conditions are different. They often involve nervous system dysregulation, inflammation that doesn't fully resolve, immune involvement, metabolic depletion, emotional or stress layering, and reduced cellular energy. Over time, the body adapts to protection. Pain pathways become sensitized, inflammation becomes easier to trigger, and the nervous system becomes somewhat reactive. The key is this: chronic conditions are rarely just structural. They are regulatory. And microcurrent works beautifully at the level of regulation. So, what do we focus on first? When working with chronic patterns, I think the first instinct is often to target the most painful area. But that is not always where we start. In fact, unless you're going to get quick relief from it, it's kind of counterproductive. So here is the framework I use. First off, calm the nervous system. If the body is in this panicked state of fight or flight, it will not heal efficiently. So instead of chasing pain, begin by supporting vagus nerve regulation, right? Begin with that vagus nerve stimulation. All of our microcurrent devices now that are beyond our most basic one, starting from the Genesis 2 and up, these are all capable of stimulating the vagus nerve. They all have the right frequencies. You have the right tools if you're using one of these devices, so you can start to regulate your vagus nerve. And this does take time, but once it begins to regulate, everything kind of changes. You can work on your parasympathetic tone, right? People talk about a sympathetic state, and it sounds almost good because sympathy is something we want. But a sympathetic state means that you're stuck in a nasty fight or flight state. And when you're in this state, you are unable to heal, right? So again, you want to be able to regulate this. Vagus nerve plays a massive role here. But you can also use things like alpha ear clips to change the way your brain is actually operating on the pain pathways. You can shift yourself into a parasympathetic state and begin to train your body to spend more time in it. Now, sleep quality is important as well. And when you're not sleeping, you are not healing properly. You also can't just catch up from I didn't sleep for a week to now I'm going to sleep one good night and fix all of that, right? You start to develop a sleep debt. And so it's very important to look into that as well to start with. If you're sleeping better, your body will be able to process the healing. And work on that systemic calming piece as well, right? Sometimes you are so overwhelmed with everything that you've been through that your nervous system needs to be calmed down across the board. Learn things like deep breathing. Take some time for yourself, relax, right? Have a meal that you enjoy. Just calm yourself down. Now, microcurrent can be applied in many ways here, and we've just been through a few of them, that all reduce sensory overload and quiet inflammatory signaling. And when the nervous system settles down, everything else will become easier. Now, with that played out, we move into step 2, which is all about improving circulation and energy availability. Healing requires ATP. Healing requires oxygen. And healing requires communication. Now, chronic tissues are often energy depleted, so supporting systemic circulation and cellular energy often produces broader gains than local treatment alone. So, mitochondrial recharge comes to mind here. Basic protocol that can be done with any of our devices that charges up the ATP in your cells. This will improve circulation as well to your extremities, pulling blood and moving it throughout your body. Now, in the process here, what does blood come with? It brings the oxygen you need to the tissues, and therefore it will help your body to establish that healing process. Chronic tissues are energy depleted, right? And we need to be able to fix this. Now, next, we can address the primary complaint. So once we've regulated the body, once we've started to make sure the body, the materials it needs to start to fix itself, then and only then can we look into actually dealing with the issue. Now, this will mean, say your arm has been in chronic pain, we've worked through these other processes before we have moved in at a calmer system where the local work will become better effective and better tolerated by the person, right? It's just going to work so much easier. And the order here matters. When you trigger the healing by working, I'm doing this early work, even for a few days, you start to make a difference and a shift, and your body is able to start working with you. Now, the next thing is all about pacing treatments during chronic cases, because once we're dealing with chronic issues, we have to look at the right pace. Many people look into over-treating when they start with microcurrent. More is not better. Now, daily sessions are definitely important, but with microcurrent, pacing is critical. So your treatment coordinators will tell you this. Start low and consistent, right? Instead of long, aggressive sessions, do shorter, regular sessions. You know, with vagus nerve stimulation, we're not stimulating for 20 minutes. We're stimulating for 3 minutes. We're doing it 3 to 4 times a day, but it's short, regular sessions. We're developing a pattern. It'd be the same with any microcurrent treatment. If you watch any of our older videos, we'll talk about things where we say, you know, put 20 minutes on here and 15 minutes on this. We don't do that anymore because it just doesn't make a major difference. The major changes happen in the short treatments. So do these steadily and you will start to see improvement. But most importantly, allow your body time to integrate these things. You are doing very little more than stimulating your tissues and asking your body to actually heal itself. But give it a moment, right? Healing doesn't happen overnight. Sometimes with microcurrent, that's where you actually notice it though. You treat, you're like, this didn't really change much. You go to bed, you wake up the next day, and it takes you a while to realize that it doesn't really hurt anymore because your body has had the time to actually listen to the signals and heal. The nervous system just needs to process the change. And so, yeah, I suppose let's linger on this for a little bit. Watch for these delayed responses, right? You often don't respond immediately to it. Instead, maybe you sleep better that night. Maybe your pain's gone. Maybe it's only slightly reduced. Maybe you feel clearer. Your brain's starting to feel a bit better within 2 days, right? Healing can be subtle before it becomes obvious. And avoid chasing symptoms, right? If a new discomfort appears briefly, that doesn't necessarily mean something is wrong. Focus on the treatment because the key question here is your overall function improving over time? This reflects recalibration of your body, right? This is showing that your body is recalibrating and beginning the healing process. Now, chronic healing is rarely linear. It often looks like 2 steps forward, 1 step back, then 3 steps forward. And I know that's not what you want to hear. You want to hear that one treatment and boom, you're fixed. And it happens, but it's not everyone, right? This is all going to come down to a healing journey. This is why we call it a journey, not a healing instant gratification. The goal is not perfection. It is trend direction. So there are 3 things that you should look into to build steadier progress here. First off is regulation before intensity. If sleep worsens or anxiety increases, then reduce the intensity of the treatments. If you're doing 15 to 20 minutes, that's what the protocol says, cut it in half, right? Do it for 10. right? Give your body the time to heal. Stability comes first. Stabilize your nervous system, and then the treatments will start to work much more effectively. Consistency beats force as well. Daily, gentle microcurrent sessions will produce better outcomes than sporadic, aggressive sessions. The body likes repetition, and chronic tissue needs it to heal. And then support the foundations as well, right? You can't get away with this. You have to do it. Microcurrent works best when you're hydrated, when you have balanced minerals, when your protein intake is good, when you have gentle movement, and when your stress is lower. Microcurrent supports communication, but your body needs the resources. If it doesn't have them, it's not really going to be able to do anything. Now, hope doesn't come from dramatic one-session transformations. Hope comes from improved tolerance and reduced flare intensity and shorter recovery times, better sleep. These things that we've been talking about, even just emotional resilience. And I think when clients start noticing that, hey, I recover faster now, that in and of itself is real progress as well. Chronic healing often begins with improved regulation before symptom elimination. And microcurrent excels at restoring communication and cellular energy. This is the foundation of repair. But you need to regulate your system first. Now, if you are working with a chronic condition, I want you to remember this. Your body is not broken. It has adapted. Microcurrent doesn't override your system. It supports it. The key is pacing, consistency, and focusing on regulation first. Because when you calm the nervous system, when you improve cellular energy, when you build steady input over time, healing becomes possible again. Chronic doesn't mean permanence. It means be strategic. Okay, so thank you everyone for joining me for this episode of the Pain Free for Life podcast. If this resonated with you, please share it with someone who needs to hear this. There are lots of people out there that need to know that they can get through this. And it's really important to understand that a healing journey has to have structure, but we're here for you. That's what we do. So thanks everyone. I'll see you in the next episode.